The Elliot Health System is committed to delivering the highest possible quality patient care. And we expect to do this in an environment of open communication, where all members of the care team involved in a patient's procedure communicate effectively. This includes the performing surgeon, the anesthesia provider, nursing, and technical support. In fact, this is what our patients expect of us. They expect that we will engage, address all concerns, and answer all questions to ensure their best possible outcome. The Team Steps approach you're about to see in this video was constructed by your peers, and it serves to create a process that engages all members of the care team maximally so that they can contribute effectively, and also puts in hard stops that effectively eliminate possibilities for error. At the core of this delivery model is open, timely, and clear communication amongst professionals. This is the standard for the Elliot Health System.
Krista, my name's Eric. I'll be the circulating nurse taking care of you this afternoon. There's a few safety steps that we take before we get started. When Dr. VER comes in, we're going to do what we call a timeout. It's a national safety initiative, not just here at the Elliot, but we want to make sure we have the right patient on the table, the right procedure, all the equipment. Right now, we're just going to do a quick sign-in. So we're going to ask you your name and date of birth, and I'm going to verify with your ID band here. Can you tell me who you are?
Kristen Jacobs.
And your date of birth?
7/4/1977.
Okay, when Dr. VER comes in, we're going to do something similar to that. He's going to ask you some of the same questions, okay?
Okay, thank you.
Great.
Are we all set to begin?
Okay.
Do you have any questions?
No?
Okay.
Sign in complete.
Good morning.
Good morning.
Good doc. Good morning, guys.
Good morning.
Hey there, how are you?
All right, good morning, good.
Nice to see you. How have you been doing?
Very good.
Did you have a good weekend?
You did?
Good. Any chest pain at all?
No, I've had no chest pain.
Great, okay. So we're gonna get started, and we're gonna have a quick timeout where we're gonna talk about you, just to make sure that we're all on the same page together. If we say anything that's not true, or we're making up any stories about you, just let us know, okay? And then we'll get you nice and relaxed and start, okay?
Okay.
All right, we'll just start in a minute. All right, everyone ready for timeout?
Yes.
Okay. Let's introduce ourselves since we have a visitor here. I'm Carl, I'm the cardiologist.
I'm Lenora, be on the monitor, nurse.
Brian, scrub tech.
My name's Eric. I'll be the circulating nurse.
And I'm Nancy, student nurse.
All right, so this is Ms. Jacobs. Date of birth is 7/4/77. She is a woman with a history of right coronary stent about 8 months ago. She's had some recurrent chest discomfort. And so we've got a stress test, which was abnormal. We're going to do a left heart cath by a right radial approach to see if the stent's still patent or there's new disease. And so, Eric, can you confirm that we've had signed consent and that she is who she says she is?
Yes, confirmed.
And you signed the consent in the motion?
Yeah, we did. Okay. Any allergies at all?
She is allergic to penicillin.
And what's your creatinine?
0.65 normal.
Great. Okay.
All other labs are normal.
Good. Brian, we have everything we need for radial access.
All equipment accounted for, and I have 100 mics and nitro on the table.
Okay, excellent. Okay, so anyone with any concerns, special needs, or patient red flags?
She told us this morning, Dr. VER, she hasn't taken her Plavix in 3 days.
Okay. All right, so then if we go to intervention, let's think about a different antiplatelet agent for more quick onset of action then. Okay, we'll have to figure that out. Okay.
And where she just had a stress test, do you want to do an LV gram or are you going to just dip?
Well, let's see what happens after we get.
Okay.
Okay, then, so then if anyone sees anything you think is unsafe, I expect you to speak up. Call hard stop if necessary. Is everyone ready?
Ready?
Ready.
Okay. Everyone ready for a debrief?
Sure.
Yep.
All right, so why don't we start with you? Let's think about what went well, what did we do well, and what can we improve upon for the next time.
Well, I have a question, Dr. VER. You loaded her with Plavix at the end of the case. How many milligrams did you use?
600.
And if she had taken her Plavix in the last 3 days, what milligram?
Then just the regular 75 a day. She would have been already inhibited. Good question. Okay.
Thank you.
Eric, anything for you?
I don't think so. I think everything went pretty well from my circulating standpoint.
Okay. Brian?
I think everything went well. We could have had that stent on board. But It seems we used it in the previous case, it was not here, and it was in the other room, so next time we'll get that involved.
All right.
I thought that there was great communication. I knew what was going on for documentation purposes, and it went well.
I think it went well. Communication was great. It's nice to have a student here. I agree. I mean, you know, I know we just finished the case and you guys turned the room over fast, but if we use a product and we only have one or two, let's make sure that we restock that before so that we don't have to run out. But otherwise, I think everything went well. Great, good case. How'd it go for you, Ms. Jacobs? Did everything go well for you?
Yes, it did. Thank
You comfortable?
Yeah, everyone was fantastic. Thank you.
Great. Okay. Thank you.
Thank you.
I think the Team Steps program has really improved what we do here in the Cath lab. Before, we did a timeout that was pretty much by the book. No one really paid it much interest. It was just one of those things that we had to do to comply with regulations. Now, the Team Steps program has really taught us that the timeout is really valuable. We've no question seen that the members of the team in the Cath lab are much more engaged, they're much more empowered. Even students in the room feel that they have a role in the procedure and they add their information and they also ask questions, which is great for the whole team. So it's really improved the dynamic of the group and it's also improved patient care. We really know what we're doing, we're on the same page, and we're much more in sync with what we're doing, just from something as simple as the Team Steps process. In terms of the debrief, that's really been unexpectedly successful. I didn't anticipate that we would have so much really valuable information coming out of the debrief. It's interesting to really hear everyone's opinion about what went well and what didn't go well, and we've been able to pick up great bits of information that we've enacted, put into use really as soon as the next case, that have improved patient care, and they've made real differences in what we've been able to provide to our patients.